From KETK, you're watching East Texas Live.
Welcome back to East Texas Live on KETK, everyone. We've got Terrence with Net Health here to talk all about Stroke Awareness Month. Always glad to have you in the studio with us, Terrence.
Do you really mean that?
I really do mean that.
I'm just messing with you.
Oh my goodness, I come back from
Gotta
vacation.
keep on your toes.
All right, okay, so let's dive into this. Is stroke the leading cause of preventable deaths here in East Texas?
No.
All right.
Good question. There's actually studies from the CDC per 100,000 people, so the population of Tyler on average. Stroke is actually the 5th leading cause of death. The number 1 cause is heart disease. So you have heart disease number 1, stroke number 5, you have diabetes at number 8. So I mentioned those 3. Those are 3 preventable health conditions that anybody can change just based on your daily habits, your lifestyle activities. So it's what we always say: eat right, drink plenty of water, exercise, get sleep. So doing those activities to help prevent and lower your risk of developing a stroke.
All right. Well, how does a stroke happen? We got some props here to kind of help with the show and tell.
So there's 2 different categories of a way a stroke can occur. One is a clot. So you can think of it like you're making a recipe. If you add too many ingredients into your blood system, then your blood is going to thicken to the consistency like ketchup, or a little bit thicker. Your blood consistency should actually be a little bit more like syrup. So that's to help prevent the clotting aspect of having a stroke. The other way is your blood vessels can rupture or hemorrhage. So you can think of it like pipes in your house or pipes in your car's engine. If there's too much blood pressure going through your system, your vessels can only take so much pressure before they pop, before they burst. So those 2 categories are the ways that you can develop a stroke, but by doing some healthy changes, you can help limit having either of those situations from occurring.
Tell me, what are some of the visible signs of someone who's having a stroke?
So one way is, there's an acronym, it's called FAST, F-A-S-T. So the F is if somebody's face is sagging or drooping, where it looks like their face is cut in 2. One side has had Botox, but the other hasn't. So that's one sign. Second sign, the A, is if the person can't move their arms with the usual range of motion. If one arm can go high and the other one not so high. The S is speech, where it kind of sounds like the person is rapping, but they're not, or they're talking normally, and then it's just incoherent gibberish. There's the S, and then the T is the time aspect. The longer it takes for a person to get medical care, if they have any of those first 3 symptoms, then the outcomes may not be as good unless they can get to a medical professional pretty quickly. That's
a lot of things scary that can happen there in a row. Tell me, is there a list of things that we can do preventative step-wise to keep from having a stroke?
Well, some of the things I mentioned earlier about eating more healthier food, nutrient-dense foods. Hydration is a key element. So not necessarily keeping your blood thin, but keeping it from getting to that viscous, thick level. Smoking, and I'll say nicotine ingestion, so not just cigarettes, but e-cigarettes, vaping, and then just keeping your annual wellness visits, checking in with your doctor, having regular blood pressure screenings done, just to make sure your blood pressure is in normal ranges.
And how can Net help anybody out there? Net Health help. There we go. That's kind of hard to say back to
Net Health.
Net Health help. Any of our viewers out there who looking for some free ways to help take these preventative steps?
So we have a free resource. It's the Center for Healthy Living, where we have community health workers. We put on free blood pressure screenings. We do education classes. We have diabetes education programs. It's free to anybody in East Texas. You can give us a call at 903-593-7474, or you can visit our website, mynethealth.org, or you can physically come to the Center for Healthy Living, which is pictured right now. It's on 155 South, corner of Walton Road and Frankston Highway.
All right, we'll get all that information linked for you over on our website. That's KETK.com. A lot of good information you brought in today. Again, always nice to have you, and I mean it.
I like you too, Jed.
All right.
You're a good guy. It's a good guy.
All right.